Prevention today is a science-based approach to addressing risk and protective factors. Prevention is about us taking an approach where we want to kind of stand upstream, look at those risk factors, and make sure that we're actually catching individuals before they fall into problems around substance use.
If you think about a body of water, people drowning, possibly with addiction, substance use disorder, people around the edge are saving them in crisis situations, throwing lifelines, pulling them in for treatment and services. But then there's that person that kind of looks upstream and starts walking upstream, and the people, they're saying, "Where are you going?" And they turn and say, "I want to find out why people are falling into the river," and start implementing programs to prevent people from falling in to begin with. Here in New Jersey, we have a very comprehensive prevention system. There's the New Jersey Prevention Network, and we're the statewide agency that has been in existence celebrating 25 years. And there's prevention agencies in every county covering the entire state. And there's also municipal alliances covering many municipal level communities providing prevention services. Across the country, we are really recognized as having an advanced system of prevention because we maximize the reach by having our prevention agencies in every county, implementing evidence-based strategies, evidence-based programs throughout their communities.
Prevention today, I feel, it understands that there's a much broader impact on the individual than just a person's individual behavioral choices. We understand that there are genetics, there's brain function, and there's the impact of the environment and the community on the individual. And all of these things impact our health and the choices we make.
Prevention has evolved over the years. It's really bringing together our key community stakeholders, our coalitions across our county, and our school districts and those that work with our young people, and marrying the two to be able to provide curriculums, evidence-based programming, strategies to our school kids, and working with our communities to also bring about evidence-based strategies and policies to help reduce youth substance use. That's key.
Prevention work today looks very different than it did 20 years ago because our communities have changed, our kids are under more stress, and our laws have changed to adapt into a space where we have different substances and different stressors on our kids. So our conversations now are more targeted towards goal setting, community building, and building attachment between youth, families, and communities so that they feel supported and safe.
Substance use and mental health are interconnected, and that we not just teach individuals about healthy choices and provide them resources, but that we also look at policies that impact the individual in the community, that we build relationships with individuals through our programs and services so that they know that we care about them and that they know that our staff is here as a resource to help them on their journey of health and wellness.
I would say the most impactful work our agency is currently doing within our prevention team is the work that we're doing to address adverse childhood experiences. We have woven education on ACEs throughout all of our curriculums that we do in our schools. We've really been working to increase protective factors within our kids. We serve about 3,000 kids a year in evidence-based programming, which means kids are either in the 6-week program, 8-week program, or 15-week program, and we're able to weave asset building, increasing protective factors within all the kids that we serve. And that really is impactful because kids are able to identify at least one person that they can turn to in the event that they have something that they need to talk about. They know community resources, and they feel like they have support.
When we're doing prevention work, we want to understand that there is a science to that. It's just not, let's make up things that'll work, right? We want to make sure that there are checks and balances, that if we do these things, then we will have some validity to what we're saying. And so today, this program has been researched to say that if somebody uses this program, does the program to the fidelity of the program, that you will see a reduction in substance use with young people. And so that's why, using things like programs that have been researched, that have been science-based, really will provide the most effective prevention programming out there. Evidence-based programming fits into the bigger picture of prevention by really giving us guidelines and helping us set up objectives to what we need to cover when we're working with different populations. So if we're working with youth, there are programs that would be effective. If we're working with the senior community, there are different programs that would be more effective for them based on their real life experience, what they're going through, and how they are really relating to the material that we're giving.
The Strengthening Families program is an evidence-based prevention program that focuses on parents. Many programs focus on youth. This really focuses on teaching parents a variety of parenting and life skills, but it also involves and includes their children as well. It also brings the family together to talk, to have dinner together, to learn from other parents in the community. As far as how Strengthening Families helps us reach harder to reach families, we work very closely with all of the schools throughout the counties, and the schools will help us identify families in greater need that might not normally be reached.
Individual and family programs that are implemented across the state really look at risk and protective factors. Sometimes people think our prevention work is just about telling people not to do drugs, but it really is more about skill building. Some knowledge about the drugs that are out there and their impact, but really more about the skill building, decision making. We work with parents on parenting, positive parenting, and then of course with youth, giving them skills like good decision making, really identifying support systems that they need, ways to deal with the anxiety and stress that they're experiencing, making the connection, a stronger connection to parents, and having parents realize that they can really influence their kids in a positive way.
We realized that we needed to focus our efforts on larger scale population-based programs as well, things that are often called environmental strategies. But before we did so, we needed to determine what we would focus on with these environmental strategies. So we convened a group of stakeholders from throughout state government and the community to come together and utilize the 5-step strategic prevention framework to identify these priorities. We analyzed a lot of state level data and determined that underage drinking, prescription drug misuse, the use of illegal substances, and the use of new and emerging drugs of misuse were the priorities we should focus on. We had a really united, concerted effort throughout the state to all focus on these priorities at the same time, which enables us to see change at the state level.
We now use something called the Strategic Prevention Framework, and looking at the risk factors and looking at the conditions in the community and making sure that we're doing a needs assessment, that we're planning, and we are implementing appropriate and culturally sensitive programs for that population to bring about change.
Well, at North Hunterdon High School, we focus a lot on prevention resources right at the start of the students' freshman year. We partner with our local Hunterdon County Prevention Resources here. They actually come into the building and work with our students all throughout their time here at North Hunterdon High School. We do some pre-prom programming, some graduation programming. This time of year now, we're getting ready for prom and graduation, and we're really focused on keeping kids safe.
So the most impactful part of being a student assistance counselor is connecting with the students and giving them an opportunity, a safe, judgment-free place to come and talk about their concerns, their questions, any situation they might have regarding substance use or their mental health, making sure that we can equip them with the resources that they need to take good care of themselves.
Amy, I don't know about you, but the work that we do, it's ever evolving. So to have it fit into the bigger picture of prevention means a lot. It means that agencies, organizations are truly seeing what it is that we do. They see and know our worth. They support us, and they show up to our conferences, and they pour into us so that we can go back and turnkey all of the relevant and important information that we get.
So when you think about the work that I do, I am very focused on legal education and empowering everybody to understand the law and how we can use our law to support our students. There is a huge system of supports that are available. So understanding how to connect the law with the available supports from school districts, from outside agencies. New Jersey has a huge statewide effort to address mental health needs and substance use needs, and just helping everybody figure out where are the supports, what is everybody's job. I'd like to say when I work with school districts that everybody has a role. It doesn't matter what you do in the school. You can be the person who matters more to that child than anybody else.
My working model would be, again, to use schools as a hub. We've created school resiliency teams in just about every school in Cape May and Atlantic County. And those teams are in-house school teams that are designed to spread the work inside the building. So that the adults can learn how to best create resiliency in the kids that they're working with.
A lot of the prevention work that we do as well, again, that some people don't realize, are what we call environmental strategies. So that's really looking at the community and what's impacting both positive influences on youth and possibly negative influences on youth, and implement strategies to address those things. Sometimes it's considering the policies that are needed within schools. NJPN just created an evidence-based toolkit for marijuana policies in the school settings and marijuana policies in the community settings. Really looking at what best practices are and how policies can be developed with a public health view in being supportive, reducing access to substances for our youth. Not having situations where positive substance use is being promoted, kind of reducing those negative impacts. The policy work that we do are often on what I say is like small P policies, so they could be in school systems, they can be in general communities, and then there's big P policies, which actually can be law policy changes. So the advocacy that our agencies are able to do in educating policymakers on really what makes really the best public health approach to some of these issues, that sometimes this work can take a long time. Some examples that our prevention in New Jersey has worked on is changing the tobacco age of sale to 21 and requiring kids to have to be 21 in order to purchase tobacco, because we know that the later people start using tobacco, as an example, the less likely they are to ever start, or the less likely they are to become addicted.
One example of how advocacy works best is by changing policy. Marty Mann, who was one of the first women to get sober in Alcoholics Anonymous, went to Congress, testified in front of Congress about alcoholism being a disease, which led to funding for the United States government for the National Institute on Alcoholism.
In our AED kits at North Island High School, we have our naloxone and Narcan in there. We actually have a lot of our staff members and coaches and trainers and nurses all trained in how to administer Narcan. So for us, it's just one more way to ensure that we keep students safe.
To be able to have the opportunity to network with each other and understand the services that are being provided in each of those different components of services, and being able to strengthen the connections that happen between those. Because each of us are doing our good work, but we also have to work collaboratively across the continuum to support each other.